So why don't you start by introducing yourself, your name, your title, and the organization that you represent.
So I'm Scott Kornhauser from Chicago. I'm the Executive Vice President and co-founder of a company called KlearTrust. And KlearTrust, in a nutshell, is a solution for adjudicating value-based contracts in healthcare.
That's great. Well, welcome, Scott. Is this your first HITLAB Summit, or have you been to these before?
It's my second.
All right.
I was in the fall one this past year.
Okay, that's great. So what keeps you coming back to the summits? What have you gotten out of them in the past, and what do you seek to get out of this one?
So first and foremost, it's a great networking event. Not necessarily high volume, but very high quality.
Right.
Our primary customer target is the drug manufacturers, and HITLAB has a nice Rolodex that's represented at these events.
All right, absolutely. So talk to me a little bit about KlearTrust. You gave a brief synopsis earlier, but if you could go a little bit more into depth about your mission and who you're trying to get in touch with and impact.
Yeah, so the problem we're solving for is that while the 75% of the market contracts for healthcare between payers, providers, et cetera, are now considered value-based agreements. They're more outcomes-oriented versus fee-for-service. Those agreements are largely adjudicated on Excel spreadsheets and through retrospective analysis. Data is aggregated over time, analytics are run, and reports and scorecards are produced. We think that's a problem, largely because it doesn't give everyone the opportunity to really optimize care and outcomes and performance under these agreements. And so we're bringing a real-time solution to market where we can follow the patient journey, starting with high-cost pharmaceuticals, specialty drugs, multi-million-dollar therapies, where we can represent the terms of that value-based guarantee as a set of rules and computable algorithms. And as we follow that patient journey and collect data, we can continuously compute whether anyone in the care of that patient, including the patient, is performing in a way that's inconsistent with the terms of the guarantee or the warranty. And if they are, we can let them know and give them an opportunity to correct course and optimize performance.
Yeah, absolutely. So how long have you been involved in digital health and the health tech?
Well, I guess it
industry?
depends how you define digital health, but I've been building healthcare tech computing solutions since the mid-'80s.
Wow. So before digital health was even kind of a term that people use.
Yeah, the first problem we tackled was real-time pharmacy claims processing. That was born out of necessity. The industry really had no choice. There's over 4 billion pharmacy transactions in the market today in real time. Imagine you went to the drugstore, got a prescription, and 3 months later you got a letter in the mail telling you that drug could kill you.
Right. Yeah.
Or that it was contraindicated for you for some reason.
Right.
And so we solved that problem back in the early 90s.
Yeah.
And I was fortunate enough to lead a company that brought the dominant claims platform in the market to address that problem.
Yeah, that's fantastic. So in your time working in this field, what are some major changes that you've seen for the better, and what do you predict is going to continue to increase in popularity or continue to change?
So of course, AI and machine learning and digital therapies, there's lots of buzz and there's lots of emerging and advancing technology, which is all great. The challenge in the US healthcare market is we're so fragmented and there's so many point solutions to address small problems that we end up with a huge orchestration problem, and enabling the market and stakeholders that are trying to take care of a population or a patient are challenged to make all of those point solutions into a coherent solution. And so I think increasingly we've got fantastic industry standards organizations around technology, interoperability, data.
Right.
Those organizations are making great progress. Fortunately, we have some great legislation coming out of the federal government to adopt those standards and to advance how we use healthcare data and make it accessible. And with all that tailwind, I think that we're going to make some leapfrog progress over the next decade, which sounds like a long time, but that's lightning speed in U.S. healthcare
Definitely.
transformation
Absolutely.
towards a much more real-time, interoperable, intelligent, smart healthcare system that really takes advantage of all this new technology in a way that is truly seamless and useful.
Yeah. So do you think that there's going to be more hurdles, I guess, or more obstacles in the development of the technology or the adoption of it and the implementation into the healthcare system?
I think the adoption and implementation is actually harder than the technology.
Yeah. So I understand that you were invited as a guest speaker at the summit. I was wondering if you could give a brief summary of what you're talking about and what you want the audience to take away.
So I admittedly was trying to be a little provocative. The title of my session today was Health Economic Value as a Service.
Right.
We talk about software as a service, but when 75% of the contracted engagements in our healthcare system are value-based today, how do you deliver on that value? And how do you continuously optimize that delivery and those outcomes? And so that requires continuous active intelligence in the hands of everyone involved in the delivery of that care. And so again, a report 90 days after service, a scorecard, a benchmark is informative and it's useful, but it doesn't go very far towards continuously improving care and outcomes.
Right. All right. Well, Scott, thank you so much for chatting with me today and for your insights. I really appreciate it. And good luck to you and KlearTrust and the rest of your endeavors.
Thanks very much.
Yeah, absolutely.